Hello everyone, my name is Phan, the lecturer of the Faculty of Dentistry, University of Medicine and Pharmacy at Ho Chi Minh City, as well as the manager of the dental clinics High Dental in Ho Chi Minh City.
Thank you for joining this lecture. Today, I will discuss dental tourism in Vietnam from a clinical and educational perspective. Dental tourism refers to patients intentionally traveling abroad to receive dental care. In Vietnam, this trend has grown in large cities such as Ho Chi Minh City and Hanoi. Patients include foreign visitors and overseas Vietnamese, also known as VQ. Due to the historical events and socio-economic changes, many Vietnamese people migrated to neighboring countries or other continents in the last century. According to World Bank and Nomad data 2021, more than 3 million Vietnamese currently live overseas. Large communities are found in the United States, Japan, Australia, and several European countries. This population represents a stable and important group for dental tourism in Vietnam. Currently, dental tourism in Vietnam is mainly organized in three ways. First, word of mouth is an important part of marketing. Many Vietnamese overseas patients are introduced to the dentist by their friends or family who have received and were satisfied with the dental treatment in Vietnam. Second, thanks to the development of digital marketing, social media, and web-based platforms, many foreign patients contact dental clinics directly via email, social network accounts, phone, etc., and arrange their out travel. Third, some clinics cooperate with medical concierge services that help with the scheduling and logistics, and nowadays, in the smaller number of cases, travel agencies collaborate with healthcare facilities to launch travel products combined with oral health services, making them more competitive than others. From clinical experience, most dental tourists seek simple, predictable procedures such as scaling, fillings, whitening, and single ceramic crowns and veneers. These treatments usually require a short stay of 1 to 7 days, which is the most appropriate for their short-term traveling schedule. More complex procedures often need longer treatment time or multiple visits, such as implant therapy, full mouth rehabilitation, and even orthodontic treatment, which may not be commonly indicated. From a clinical perspective, these cases often require careful planning, interdisciplinary collaboration, and clear communication, especially when the treatment time is limited. This represents one of the main clinical limitations of dental tourism. Cost effectiveness is one of the main reasons patients choose Vietnam. Here is the table summarizing some common dental treatments with the price currently applied in most dental clinics in Vietnam, so you can refer to this price with those in your country. However, cost alone is not sufficient to attract well-informed patients. The next factor that I mentioned is also essential for the patient's decision. That is the quality of treatment based on the growing clinical expertise of Vietnamese dentists. Nowadays, many Vietnamese dentists have graduated from developed countries, and many foreign experts have been invited to Vietnam for short-term training courses. Other important factors include short waiting times and flexible scheduling. With the development of social media and digital marketing, It is easy to book a dental visit from afar before your departure to Vietnam. Last but not least, Vietnam offers a wide range of natural and cultural attractions, which can be combined with short-term dental treatment. The tropical weather with the long coast attracts a lot of tourists worldwide. Therefore, many patients also value the opportunity to receive treatment while traveling or visiting family in Vietnam. Despite these advantages, dental tourism also presents challenges. Common issues include language barriers, differences in aesthetic expectations, and uncertainty about long-term follow-up after patients return home. These challenges require dentists to improve their communication, documentation, and treatment planning skills, especially when working with international patients. Effective communication strongly influences patient satisfaction. Most dentists communicate well in Vietnamese and English. However, other languages, such as Japanese or Korean, are less common in Vietnam, which may lead to misunderstandings regarding treatment expectations or risks. Currently, we have worked with dentists, politicians, and businessmen from Japan to highlight the importance of broad cultural communication training in dental education. Dental facilities in Vietnam can be broadly classified into three groups: registered private clinics, university dental centers and specialized hospitals, and family clinics. Registered private clinics often focus on aesthetic dentistry, such as teeth whitening and ceramic crowns. These are standard addresses for dental tourism. University dental centers and specialized hospitals are strong in surgery and complex cases treatment, serving the needs of local residents primarily. Due to the long-term follow-up required, these services are challenging for foreign patients. Besides, family clinics may vary significantly in quality, so careful selection is important. From 2024, the Ministry of Health launched a new policy to improve healthcare quality, requiring all clinics to be registered and accredited by Department of Health in each province or city. If they do not meet the minimum quality standards for infection control, radiation protection, wastewater treatment, and fire prevention and control, they may not be branded or may lose their license to practice. Many dental tourists arrive with treatment plans from their home countries. However, the treating dentist in Vietnam is fully responsible for diagnosis and treatment decisions. Therefore, a new clinical and radiographic examination is always necessary. Sometimes, for complex cases, the dentist needs to contact previous doctors to consult the patient's medical history. In the future, dental tourism in Vietnam is expected to develop with a greater focus on quality assurance, digital dentistry, and international collaboration. For dental students, this trend provides an opportunity to reflect on how dentistry is practiced across different healthcare systems. In conclusion, dental tourism should be viewed not only as an economic activity, but also as a clinical, educational, and ethical issues in contemporary dentistry.
Thank you very much for your attention. I hope you enjoyed the video and wish you success in your study.